It is the second most common cancer that affects men behind skin cancer, and many men may not even know they have it. Men's Health Week kicks off tomorrow with the focus on prostate cancer. So, what should men and people who love them know about prostate cancer? Dr. Ash Tewari is chair of the Department of Urology at Mount Sinai Medical Center in New York and chair of the Milton and Carol Petrie Department of Urology at the Icahn School of Medicine, also at Mount Sinai. Dr. Tewari, welcome. Thanks for joining us. Many men may not even realize they have it. What would you tell a man right now watching about prostate cancer?
Thank you, Eric, for having me here and talking about an important topic, prostate cancer. Prostate is a silent killer. It will not produce any symptom till it is really problematic. So they just need to go out and talk to their doctors that could they have a prostate cancer. And it is usually done by a small test known as a PSA. So prostate-specific antigen is the test for them to do it. That will find the cancer early, and there are so many things which can be done to take care of that problem.
Is there a PSA number that, is normal that people should have? And what alarms you when you see a PSA going up?
So PSA is very individualized for a particular human being. A normal number of anything about 2.5 or above to 4 is considered to be abnormal. But a normal for one person may be different than a normal for an older person. So it's important to establish a baseline. It's very important to talk about PSA right now because in next 20 years, they are expecting that the incidence of prostate cancer will double and the mortality will go up by 85%. And only way to kind of overcome that is by a smart detection of the prostate cancer early. Important thing to know is that not every person who we find prostate cancer needs to be treated, needs to be biopsied, but finding about the cancer early makes all the difference because there are many options, including watching the cancer early.
Yeah, there's some symptoms, I guess, that do occur. A frequent urge to urinate, back pain, for example. We're going to put them up on the screen. Frequent urination at night, weak or interrupted urine flow, blood in urine and semen. Once you get to that point, though, what do you want to see and how do you then treat prostate cancer?
You really don't want to have any symptoms because of prostate cancer because some of the symptoms, they overlap with the benign prostatic hyperplasia, like getting up again and again in the night, having a difficulty in passing urine. But if it is happening because of BPH, it's very easy solution. But if it's happening because of cancer, that means we waited too long. We would rather find cancer by PSA and the imaging rather than by the symptoms. So if they are having these symptoms, they need to go to a urologist to check it out. What's the reason for that? And 9 out of 10 times it will be a benign prostatic hyperplasia for which we have many small treatments, drugs, and evaluations.
And for PSA screening, Mount Sinai recommends a baseline at 55 years old. So, folks, if you're a man and you're 55 years old, that's the baseline screening. All men over 55, they say, should get it. Black men over 45 years old, because the rate is 70% higher for African Americans. That's a concern, Dr. Tewari. How do you speak to that?
Not only that they have a higher incidence, they have to double the mortality. So we need to start early on in black men, and that is the reason we have started in what we call a strong million men for prostate cancer detection. We have a mobile unit which goes out to different areas to find the cancer early, and now we are expanding and partnering in different parts of the world. And we are going to reach out over 1 million men in the next 10 years and find their cancer early, because finding the cancer early not only has an impact on mortality, but it also has an impact on the quality of life. That if you find the cancer early, not only that you can save the life, you can also do things to make the cancer treatment a little bit more tolerable in terms of they don't have a sexual dysfunctions, they don't have urinary leakage. A lot depends on when you find the cancer. So this mobile unit has already crossed 6,000 men right here in New York, and we are now thinking about taking it to Atlanta, to Washington, and to another part.
We're looking at the mobile unit now, and what strikes me finally, Dr. Tewari, is many men you know how men are. You don't want to go to the doctor, you think you're okay, you want to put everything off, and you're reluctant to get a test. And a PSA test, it's very simple. You just get a blood test. What would you say to any viewer now watching who could be reluctant, and what's your advice to men?
I think a blood test can save life. And it's important to get it done. And in the mobile unit of this kind, You don't even have to wait 1 day or 2 days to get the PSA results back. You can get it back in 20, 25 minutes. That's the beauty of this. You don't come to us, we will come to you, but you have to accept us. And that's the key message. PSA is just about finding the cancer early. Not everyone with an abnormal PSA needs a biopsy. Not everyone with an early cancer needs a treatment. But missing an aggressive cancer which needed a treatment and not finding it out this year and finding it out next year makes me sad.
Yeah, it is so easy to do. Just get checked if you can with the blood test. Dr. Ashwari of the Mount Sinai Medical Center, thank you for coming on with us and sharing your message for Men's Health Week.
Thanks a lot for making it happen. This is the right time to talk about it.
Of course it is. And thank you for what you do.